Well, the prospect of opening the Canada-US border is triggering mixed reactions among Canadians. Some want the border to reopen for social and economic reasons. Others, though, concerned about the health risks as a result of the coronavirus outbreak in the U.S. Both countries agreed to close border crossings to non-essential travel until May 21st. This week, Prime Minister Trudeau hinted at extending the closure for at least another month. For a closer look at all of this, we're joined by Craig Janes, and he's in Waterloo, Ontario, and he's the director of the School of Public Health and Health Systems at the University of Waterloo. Craig, thanks for joining us. Really appreciate it on a holiday weekend.
Good to have you.
Let's talk about how concerned you are about Canada reopening the border with the U.S.
Well, at this point, I'm quite concerned. You know, there's a lot of uncertainty about the shape of the pandemic in the U.S. now, coupled with the politicization of protective behavior, distancing, wearing masks. All this has become sort of a political act rather than a public health act. And this certainly has me and public health leaders in the U.S. really worried that we may start to see surges in certain places, outbreaks, or even the sort of dreaded second wave. There's certainly been some recent worrisome spikes in places like Arizona and in Texas. And of course, we're looking very carefully to see what happens with Georgia. So all of this has us concerned that if we were to open the border and allow unrestricted travel, that we may start to see some of that infection moving our way, either Canadians traveling, bringing back the disease, or Americans coming here. So with all the risks and uncertainties, it would seem to me that the precautionary principle would suggest that we keep that border closed or certainly carefully restricted, at least for the time being, until we see sort of what happens in the U.S. and whether the epidemiology remains stable enough for us to consider other options.
We've seen Canada deal with this province by province and, of course, the U.S. state by state. But if it is possible to characterize an overall approach of the two countries, how, in your mind, has the Canadian and U.S. approach differed?
Well, the U.S. approach has really been characterized by a whole lot of variability. There hasn't been strong central federal leadership, certainly on the public health side. And what that has meant is that, of course, many of the states, and even within states, certain local jurisdictions have kind of gone their own way, which has led to very, highly variable responses, some states opening early, some states really imposing very few restrictions, and so forth. Whereas in Canada, the response seems to have been a little bit more coordinated, a little bit more consistent across the provinces. And I think certainly the big difference between the two countries is in Canada, you really see the prominence of public health leaders informing policymakers, and having those policymakers, for the most part, paying attention to public health leaders in terms of the decisions that they're making.
So as they make those decisions, what kind of protocols or guidelines would you like to see either before the border reopens at all or some sort of gradual reopening?
Well, certainly you want to at least see a couple weeks of pretty flat curves in the U.S. And also on the Canada side as well. I mean, we're talking about an integrated relationship between the two countries. So you want to see some sort of stability there, and probably we're talking 2 to 3 weeks where you don't see big spikes and that sort of thing. I mean, that's certainly probably the first step, first thing we want to take a very careful look at. And then once we do start to open, the two countries are really going to have to begin to coordinate their efforts here to make some decisions. Are we going to just simply allow anybody to travel, or are we going to restrict travel to those with family? How are we going to screen passengers in airports, on airplanes? So there's a whole lot of decisions that would have to be made, and those decisions would need to be done in a coordinated manner. And probably most importantly, I think policymakers will need to figure out what the triggers are. If suddenly we see spikes, does that trigger then a reclosing of the border, and what might those triggers look like?
Presumably, though, you understand this is perhaps the largest trading relationship in the world, and there is a tremendous amount of pressure, not only on Ottawa, but presumably in Washington, too, to open up that border. How can you convince those who are making the economic argument that the health argument should trump that, at least for a while?
That's a very difficult decision to make. I mean, you are very, very right in pointing out the economic relationship and the importance of that relationship. Also, the social relationships. You know, a lot of family are on the other sides of borders and that sort of thing. So there's going to be enormous pressure to open those borders. and it will never be risk-free. We're never going to have risk-free travel. So what is that balance? And what is that balance? And I think that once we start to see the things begin to flatten out here, if we're fairly confident on the public health side that things seem to be under control, and I think very importantly, that we have the capacity to do the screening and testing on both sides so that we can be sure and pick up people who are infected, help them be isolated, protect their contacts and that sort of thing. I think once we have that capacity, we'll be in a much better position then to open up and to really permit those kind of economic activities and social activities to start up again.
Craig, thanks for walking us through all of that. Really appreciate it. Craig Janes.
You're welcome.
From the School of Public Health and Health Systems at the University of Waterloo.